1, 2, 3, 4. 1, 2, 3, 4. Please, in 4 minutes we're going to begin in this ceremony, please. Thank you so much. En 5 minutos los invitamos, por favor.
Good morning. Bienvenidos todos.
Yes, and good morning as well from Doctor's Hospital.
My name is Alicia Wilson. I'm the Executive Director of La Clinica Del Pueblo, and I'm thrilled to be sitting here beside my new best friend.
That's the nicest thing anybody said about me for quite some time, and we're thrilled to be here as well. Alicia's going to get things started for us to talk about the partnership. I'm Paul Bernaldo. I'm the Chief Operating Officer at Doctor's Hospital, and can't wait to have everybody get a chance to see what we've put together here.
So this is a really happy day. It is wonderful to see all of your beautiful faces today. I want to recognize the staff, our patients, community members, neighbors, local businesses, government officials, both elected and appointed, and all of our partners who are here today. I think it's safe to say we have really been anticipating this moment and this day. For the past 33 years, we have worked in Washington, D.C., providing healthcare to the Latino immigrant community and to those who need it most. We've been driven by the belief that healthcare is a human right. Today is momentous because it marks the grand opening of our brand new health center and the broader footprint that we're making across Prince George's County with a school-based wellness program for recently arrived youth at Northwestern High School called the Refugio. An LGBTQ safe space and HIV prevention hub in Langley Park that will be opening shortly. And community health initiatives all across the county. You'll be seeing a lot of La Clinica in Prince George's County. We like to say the community is our patient. It was really time for us to make the move to Prince George's County to be able to provide culturally competent and linguistically appropriate care where and when Prince George's County residents need it. We've been seeing a growing number of Latino immigrants, limited English speakers, living in and moving into this area, and we've seen the limited health services available to them to meet their distinct needs. Already, since August, we've seen more than 250 patients in this site. We look forward to serving more than 1,300 patients when La Clinica is at full capacity. We'll be able to offer medical services, mental health services, social services, interpretation services, health promotion and education, and in partnership with Doctors Community Hospital, specialty services. We're thrilled with this space to have formed a partnership with Doctors Community Hospital to really help us reduce barriers to care and increase quality of care for the Latino immigrant community. With that, I'd like to turn it over to Paul to talk a little bit more about this innovative partnership.
Thank you, Alicia. No one is more thrilled about this partnership than Doctors Community Hospital. As we say, our mission is to passionately care about your health. And this project was a true collaboration that was driven by passion to do the right thing for the citizens of Prince George's County. I'll paraphrase what Mr. Baker typically says at these events. This is a great day for healthcare in Prince George's County, and we're thrilled to be a part of it. As you move to a population health delivery system, it's important that you bring the resources to the community. And as Alicia has spoken about La Clinica's move to expand into the county, so too has Doctors. Betty and I were at an event a couple years ago when we talked about the collaboration that Doctors was doing to bring mobile health out into the community, and now we're bringing our second van into play. And I had said then that Doctors will be more than just a building on a hill in Lanham, that you're going to see us all throughout the county. This is our crown jewel, quite frankly. We're so thrilled to be here. We're thrilled to be a part of it. We're thrilled to be partnered with a quality provider that's represented here by Alicia, and we can't wait for you to see what we've done here. So thank you very much for coming.
So we've got a lot of extraordinary friends in the audience, as well as being able to open this clinic has allowed us to make some new friends. I am extraordinarily honored And I hope I speak on behalf of all of the staff of La Clinica to express the honor of welcoming Lieutenant Governor Boyd Rutherford to help us inaugurate this wonderful space.
Thank you, and buenos dias. It's great to be here. Alicia, gracias por esa introducción. Trabajo bien. I actually am trying to learn. I have an app on my phone. The troopers will tell you that they have to listen to me trying to speak Spanish on our drives. So it's good for the brain power to make sure that you're constantly learning. But I want to begin by congratulating everyone involved and excited about the achievement here in Hyattsville and for the entire state of Maryland. Since taking office in 2015, Governor Hogan and I have made it our primary mission of the administration to find ways to change Maryland for the better and improve the quality of life for everyone in our state. And that is exactly why it's so exciting to see the work being done around our state and by people and organizations who share the core mission. Right here in Hyattsville and throughout the DC metro area, there's a growing need for preventive and specialty care for members of our Latino and immigrant populations. With the opening of this new health clinic, that is critical to filling that void. Thanks to all the family practitioners, the case managers, the community health workers who will be tasked with providing culturally competent care for those underserved residents of this area. We appreciate what you're doing and what you will be doing. Thank you again for inviting me to participate today, and congratulations again on this exciting project. And I'd like to present at this time a governor's citation. I will read it. I'll read parts of it because it gets a little long. La Clinica Del Pueblo, greetings. Be it known that on behalf of the citizens of this state, in recognition of the occasion of the grand opening and ribbon cutting celebration for La Clinica Del Pueblo, a nonprofit federally qualified health center that serves the Latino and immigrant population of the Maryland, Washington, D.C. area. And as an expression of our best wishes and success in providing culturally appropriate health services focused on those in need, we are pleased to confer upon you this governor's citation, signed this day, Lawrence J. Hogan, Jr., Governor, Boyd K. Rutherford, Lieutenant Governor, John C. Wilkins-Smith, Secretary of State.
We have a lot of art on the walls of our new clinic, but I am really excited to hang this. So we have a special place already picked out for this space. Thank you so much. About this time last year, we launched a very special program called Mi Refugio in partnership with Prince George's County Schools and the Transforming Neighborhoods Initiative that provides case management, therapy, group interventions, and summer activities for newcomers attending Northwestern High School. I'd first like to recognize a couple of the people who have been instrumental in allowing this to happen. I'm thrilled that the superintendent of Prince George's County Schools, Kevin Maxwell, is here to join us, as well as Betty Hager-Francis, whose title I always mess up, Deputy Director of Health and Human Services, close, who have been able to make this program possible, as well as the extraordinary staff of the TNI initiative. I'd like to welcome a special guest, Jennifer Macias, who's a participant of Mi Refugio. She's a senior at Northwestern High School, and I understand a straight A student. And she'd like to come and share her story about what it means to be a participant of Mi Refugio. Jennifer.
Muy buenos días a todos.
Good morning to all.
Soy una estudiante de la Northwestern High School,
I'm a student of Northwestern High School.
senior como ella nos presentó.
I'm a senior, as she told you in the introduction.
Les voy a narrar un poco de mi pequeña historia, cómo conocí la Clínica del Pueblo.
I want to share a bit with you of my short history and of how I came to know Clinica Del Pueblo.
Mi maestro, Mr. Bambi, él fue quien me habló de la Clínica del Pueblo.
It was one of my teachers who spoke to me of the work of Clinica del Pueblo.
Yo necesitaba ayuda en ese momento con mis tareas.
I needed help with my homework at that time.
Fue empecé a formar parte del programa con Miss Lucy.
And that's how I came to join the program with Miss Lucy.
También empecé a formar parte en el programa de los jóvenes, Mi Refugio.
And I joined the program in Refugio for the youth.
Fue como aprendí, tuve una experiencia. Tuve una experiencia en el programa. Aprendí a poderlos llevar con los demás jóvenes recién venidos a este país.
In my experiences with this program, I began to learn how to share and be with the young people that had begun to arrive to this country.
También tengo la ayuda psicológica.
And I also have the mental health support.
Me siento muy bien gracias al programa.
I feel very well thanks to the program.
Ellos también me están brindando la ayuda médica en la Clínica del Pueblo.
And they also provide me with medical services at Clinica del Pueblo.
Los doctores son muy agradables, la asistencia es muy bien.
The doctors are very pleasant and the assistants are really good.
Otra forma en la que me ayudaron este año
Another way in which they helped to support me this year
fue para hablar con mis consejeros, comunicarme en el idioma bilingüe.
to be able to find counselors for me such that I could communicate with me bilingually in my own language.
Yep. Es por eso que el programa es muy recomendable para la comunidad hispana,
This is why I recommend this program for the Latino community,
porque por eso tengo muchas ayudas.
because of the program, I have so much support.
Gracias por invitarme y todos tengan un buen día.
Thank you for having me here today, and I hope all of you have a great day.
Thank you, Jennifer. Jennifer is one of over 100 students who've enrolled in our Mi Refugio program, receiving supports as they adjust to this new country, this new county, to reuniting their families, to getting to know the U.S. high school system, and really making their way as they start out in this country. Thank you so much, Jennifer. I'd like to take a minute to recognize a variety of elected and appointed officials who are here. I want to give a special shout out to both of them have been key partners in our ability to navigate this new clinic and find our footing and really be true champions and supporters of our Now it gives me great pleasure to introduce one of my favorite people in the whole world, Judy Alba, who is a founder of La Clinica and now also an employee of La Clinica, to tell a little bit of her story as well. Judy.
Good morning to all of you, and thank you for being here. It is my honor and privilege to welcome you to today's ceremony to celebrate this new milestone in a journey that began 34 years ago. The project was started back then by a few dreamers with a big idea. The idea was to provide refuge and integral medical care to the many Central American refugees that were beginning to arrive in DC, escaping the war in the region in the early 1980s. This idea was also to provide this care in a manner that was culturally appropriate and that addressed the specific needs of this population traumatized by war and violence and war. This is the reason why mental health has been an important part of the care we provide at La Clinica del Pueblo since the beginning of our existence. Hearing Jennifer's story reaffirms who we are, and thank you, Jennifer, for sharing. I had the privilege of being among the first volunteers at this clinic when it first opened its doors in a borrowed space in an old church on Irving Street in DC. As more and more volunteers joined the effort, the dream became a reality that was truly engineered by the community itself. Some of you present here today were direct witnesses and constructors of that dream. Sonia Manzor, I'm sure you're here. And it was a great surprise to see Phil Wheaton, who operated in the same building as La Clinica, and he is here. I hope some of you have a chance to say hello. Personally, I am overjoyed and I feel deeply honored to be part of this community. I returned to La Clinica del Pueblo in 2012 after a long absence from DC and found Alicia at the helm of a truly successful organization. It was a fairly qualified health center. It had been certified as a medical home by the National Committee for Quality Assurance, and it had obtained health and quality outcomes which surpassed most national benchmarks. I also found that it was operating in a building that had been purchased and remodeled with funds raised entirely by the community. When I stepped inside, I was struck not only by the beauty of the building, I'm sorry, like this. Oh, I'm sorry. I hope you could. Okay. When I stepped inside, I was struck not only by the beauty of the building, but more importantly, by the energy of the people working in it. I felt the same energy that I felt when we operated only once a week in the old church. I truly believe that the reason was because the organization had continued the same mission and had given origin to La Clinica, and because it remained itself intimately connected to the community. The original spirit of La Clinica was both alive and thriving. Today, we are performing a ceremony to bless another beautiful space in which to continue the mission of La Clinica del Pueblo, this time in Maryland. Like 30 years ago, the opening of this new site has required dreamers and builders, leadership, foresight, and careful planning. It has also required the philanthropy of many on the board of directors and the community at large. The truth is that each and every one present here, or new neighbors, or new partner organizations, or friends and families, or patients who share our vision and aspirations for the future of La Clinica and the unique role that it plays in our community, you all have contributed in one way or another to the realization of this project. My hope as nurse manager of this site is that with the support of the amazing senior directors of the organization, Alicia, Dr. Fernandez, Dr. Wilkes, Marlene, Catalina, Claire, Rachel, Isabel, Jose, Suyana, Lily, and all my manager colleagues, as well as the staff that always goes the extra mile, and of course, our small but very, very potent team here in Hyattsville, Dr. Victoria White, Dr. Claudia Hustin, William, Kenya, Jennifer, Pamela, Melanie, Sorangel, and soon to join us, Palmir and Dr. Brown and Dr. Anthony. Again, my hope is that we continue not only serving the community and those most in need with the highest quality of care, but that we thrive performing this mission with gusto, con amor, con alegría, y con mucho humor. I also want to acknowledge the great work that the planning committee did to bring about this beautiful celebration. And thank you again for being here. And please let me welcome the staff of I just want to welcome Prince George's County executive staff that has helped us pave the way to be where we are right now. So thank you and welcome the staff of Richard Baker, sir.
Thank you so much. So, good morning, everybody. I'm Betty Hager Francis, and I serve as Deputy County Administrator for Health, Human Services, and Education. And I am filling in for Mr. Baker, who planned to be here, but unfortunately had an emergency. He is so excited. I tell the story that when we first started talking to Alicia about opening a clinic here in the county, it so happened that Mr. Baker was campaigning and knocked on her door, totally by accident. And they started talking, and the next thing I knew on Monday morning is that I really had an assignment. It was in the back of my mind before. I really had an assignment then, and here we are today. This is such a wonderfully beautiful day, and everybody is here and smiling because we know what this is going to mean for healthcare in Prince George's County. We have one of the highest, our growing population of immigrants, and especially immigrants from Central America. And I think it's probably 17% in Prince George's County. And we know that some of those immigrants, our new residents, are not able to secure health insurance. And so we are so grateful for La Clinica, who expects to serve that population. We are so grateful to La Clinica for helping our recently arrived children from Central America over the last 2 years. I want to recognize again Prince George's County Public Schools CEO Kevin Maxwell, who is absolutely really on the cutting edge of making sure that all of our students in Prince George's County have the behavioral health services that they need. We have our new Deputy Health Officer with us today as well, Dr. Jacqueline Duval Harvey. And I want Whitney Palin, if you don't mind. She actually runs our TNI at School program. And Lieutenant Governor Rutherford, thank you for being a Prince George staff. We appreciate that so much. So honestly and truly, this innovation with Doctors Community Hospital and La Clinica is unique. I'm pretty sure it's certainly unique in Prince George's County, and it may even be unique in the state. And it really takes people who are devoted to improving healthcare to think of a way to collaborate in this way. And so I just thank you all so much for being here today to celebrate. I'm celebrating, we're all celebrating today. And we just look forward to just the most wonderful healthcare and quality healthcare. And Mr. Baker sends his warmest greetings to you as well. Thank you. Well, okay, Alicia said that I could announce that the county was going to be able to actually contribute $150,000 for a first-year operation.
I wouldn't let her get off the microphone without making sure that you all heard it. We are enormously thrilled with the investment that we've received from Prince George's County. Not just a financial investment, but a support, a cheering squad, a good counsel as we're learning the ways of the county, as we're trying to be good neighbors. we have found not just a red carpet, but really open arms and an embrace from the county administration. We are thrilled to be part of the fabric of Prince George's County. Thank you so much. I wanted to take another moment to recognize a few folks in the audience that are here, and I do hope you know that this party doesn't end when we stop talking. There's a lot more to come. We look forward to you spending time with us and celebrating. But I wanted to take a moment to honor several of our patients that are here. We have many patients who have been part of the fabric of La Clinica for 25, sometimes even 30 years. And I'm in particular looking at folks that we call part of our Comité de Pacientes, our patient committee, who are good counsel, good advisors, and really they are the owners of La Clinica Del Pueblo. And I'm going to switch to Spanish really quickly. Si puedo pedir que los miembros del Comité de Pacientes pueden levantar la mano. If any patient committee members could raise their hand. There's a couple folks I see hiding back there. A great applause, please, for our patient committee members. I also want to recognize many of our board members who are here in the audience. I invite you, if you're just learning about La Clinica right now, take some time to talk to one of our board members. These are people who volunteer hours and hours and hours every month to make La Clinica a success and to guide us into the future. They've gotten us to this point, and now they've set a plan for the next 5 years as we march forward. Could I ask any of the board members to please raise their hands? And remind you that more than half of our board members are also patients of La Clinica, so they can talk about La Clinica as patients and as bosses. They're my boss, and they're a wonderful group of people, so please take the time to get to know them. And now I'd like to take a moment to recognize a couple other partners who have really helped us step foot in Prince George's County, and I'd like to invite Paul to help me with this. What we'd like to do is acknowledge folks, and as we read off your names, if you could please come up here. We have a small recognition for you, and we want to make sure that you all know that it isn't just Paul and I who've made this happen. It's really been an extraordinary group of people. So I'd like to invite a representative from each of the organizations to come up if you're present. So Care First, Blue Cross Blue Shield.
The Split Rock Charitable Foundation.
The Meyer Foundation. Not everyone was able to attend, but I want you to all know their names. The Morris and Gwendolyn Cafritz Foundation.
The U.S. Department of Health and Human Services, Health Resources and Services Administration, HRSA.
The Prince George's County Executive Office.
Our Maryland Community Health Resource Commission.
Councilmember Denita Reyes.
And Councilmember Danielle Veros.
Doctors Community Hospital. The Leonard and Helen Stillman Foundation.
And we also at this, the Cigna Foundation.
And the T&I at Schools Initiative.
We also want to recognize, you'll see when you come inside, there were so many different things that we did to try to make this an affordable project. And so one of the things that we brought to the table was that we would bring our expertise from the hospital and its construction and plant ops teams, our materials management folks, our marketing and communication folks. So I especially want to recognize and ask to come forward Angela Wilson from marketing communication, Kenyatta Keys, who helped buy everything that's here, Dave Swanson, who was our construction manager, who was here on the job every day and really did a beautiful job building this, and Jerry Dyer, who led that whole project.
I'd also like to recognize our amazing neighbors, the Chelsea School, represented by the two co-heads. Please join us as also as part of this celebration.
And to thank part of this is we've talked since we met about being good neighbors. You can't have better neighbors than when you show up this morning. Their students are setting up these tables and chairs as part of their service work, and so we're just thrilled to be a part of that. So thank you.
So I think we're going to do a quick picture. If we can sort of gather together, and now we're thrilled to have the county executive with us. We'll ask him to say a few words, and then we'll close up. So we'll do a quick picture. He was able to make it here.
Thank you. I won't be long. I heard Betty Francis did a great job. Can we give her a round of applause? This truly is a great partnership, and I want to recognize the Lieutenant Governor for being here. Thank you very much. It's truly a great day for us in Prince George's County, bringing two great organizations together right here in Hyattsville and right next to the Metro. I mean, one of the things that we talked about in this administration from the very beginning, and that was connecting healthcare throughout the county. And part of that is not just connecting the new regional medical center, not just connecting doctors, hospital, but the clinics that are very important to the community, that are the heart of the community, and also those that are most in need of services. And having the ability to reach those who speak English as a second language, who are uninsured and underinsured, is critical to us. It's critical to making and pushing Prince George's County forward. So we're so glad. This is a great day for us in the county. We're really thrilled, and I look forward to looking inside. So thank you. Thank you for being here.
And finally, to close out our program, I recognize the participation of our many board members. I'm really honored to introduce patient board member Carlos, who will be able to help us truly celebrate. What I'd like to ask after he finishes his words, we're going to do an actual ribbon with an actual cutting, and then we'll be able to come in and see this space. So let me introduce you to Carlos Gutierrez.
Thank you so much. Sí, para nosotros hoy día, para todos nosotros, definitivamente es un día de celebración.
Yes, most definitely for all of us here and for all of us in the community, this is a big day for celebration.
Hasta el clima se ha puesto de acuerdo para poner los mejores colores del día.
Even the climate is in agreement with us. It's put on its best colors for the day.
Y no puedo olvidar ese primer momento que fui invitado a una reunión de pacientes. Fueron cientos, una reunión extraordinaria.
And I go back to the first moment here when I was invited to a first meeting with hundreds of patients. It was an extraordinary meeting.
Cuando todos nosotros estábamos participando en la elaboración de nuestro plan estratégico. Yo no lo sabía.
When we were working, even though I hadn't caught up to it yet, planning our strategic plan.
Pero ahí supe que había la fuerza suficiente, la energía suficiente, la entrega suficiente como para volver a la Clínica del Pueblo, justamente eso, el espacio, para que nuestro pueblo y su diversidad se exprese totalmente y seamos capaces de construir una maravillosa organización al servicio de nuestros amigos que vienen fuera del país, a Estados Unidos, ¿no?
And in that meeting, I realized it was the first time I really could see, participating in the beginning of the planning process, the strength, the energy, the commitment that we had together, and to realize that yes, in fact, Clinica Del Pueblo had the capacity to move on to develop this space that we're celebrating here today, to put at the service of our people, at the diversity that we represent, and to serve all of us who have recently come to this country and those who have been here for a while as well.
Y hoy día de nuevo se siente esa energía. Y hoy día ya estamos fuera de DC y estamos en un nuevo estado y en un nuevo county haciendo algo importante. No solo lo que vamos a hacer adentro, sino lo que vamos a hacer y estamos haciendo en cada hogar, en cada persona que se vincula con nuestros promotores, con nuestro personal de salud, con toda la gente de las organizaciones hermanas, con todos aquellos que nos apoyan y Hagamos, por lo tanto, de nuestra sociedad una sociedad realmente saludable.
And yes, it's that same energy that one can feel here today, that we all share here today, and that it's not just about what we're going to be providing in services here inside the building, but also what that our presence here in Maryland, outside of the district, means for every family, for the people, each person in each home that we come in contact with, because we have the health promotion, we have the health education, we have the medical services and the staff that provide it, and we have the support services to serve them all.
Y hoy, curiosamente, en todos nuestros países, donde hay culturas muy diversas, porque para diversos nuestros pueblos, ¿no es cierto? Y también en todo Estados Unidos, estamos celebrando el Día de los que ya se fueron, de diversas maneras, de diversos modos. Aquí mismo, cuando nos pasemos y visitemos los locales de la clínica, hay un pequeño altarcito que hace recordar cómo se celebra en algunos de nuestros pueblos, recordando a aquellos que simplemente nos han tomado la delantera.
And today, we must remind ourselves that today is a day in our countries, throughout the countries that we come from, but also here in the United States, that celebrates in part our diversity, that we come from so many different places, and that is about remembering those who came before us. It's a day that's celebrated here as well. And in many ways, it's a day to honor those that have moved on, but that have left their legacy, and how together we celebrate what we've received from all of them.
No celebramos a muertos, celebramos a la vida, celebramos a nuestra historia, celebramos a lo que somos.
We're not celebrating necessarily death. We're celebrating life. We're celebrating their life, their history, their legacy. We're celebrating who we are.
Y gracias a esta tierra maravillosa que nos ha dado acogida, Estados Unidos, nos encontramos acá cruzando nuestras tradiciones, encontrando nuestros puntos de vista, hablando y queriéndonos mucho y preocupándonos por prevenir la salud de manera integral, porque salud no solo es estar contra la enfermedad, sino evitándola todos los días, en el colegio, en la calle, en el hospital, en todas partes.
And we give thanks to this land, our new land, the United States, the country that we've come to. And when we're able to meet and come together again and celebrate our traditions, to come together and share and exchange our different points of view, to figure out how our caring and our commitment for providing integral health services can come to fruition, can be a reality. And we're talking not only about providing the healthcare services directly, but also to heal, but also we should be talking about prevention. Prevention that should be taking place every day, that we can address through our programs in the schools, in the street, in our promotion, in the homes, and obviously at the clinics that we work with.
Como el sol nos está quemando, ya es suficiente lo que estamos diciendo. Es bueno recordar a nuestro pasado, y yo les pediría que recordemos en un momento, con un momento de silencio, a todas aquellas personas que debían estar acá, que deben estar acá a nuestro lado, y que están a nuestro lado.
And now that the sun has been bearing down on us, and we really need to cut short how much we continue speaking to you, I'd simply like to request that we hold 1 minute of silence, 1 minute of silence in remembrance of all of those that have come before, that could not be here physically in presence with us, but who in fact are here with us.
Un aplauso para ellos.
An applause for them.
Bueno, y ahora como hacen, a pesar de la diversidad hay algo que nos une, que es la alegría y la celebración. Así que los invito de ahora en adelante a tener contacto y conversar con Catalina, Dilce, Ernesto, Isabel. Somos 130 por ahora empleados de la clínica, con la gente de la Junta, con nuestras autoridades, con nuestros donantes, con nuestros pacientes. Pues llegó la hora en que vamos a conversar todos juntos, vamos a celebrar con música y comida y vamos a festejar este momento de encuentro que realmente es maravilloso. Gracias a todos ustedes por su invitación. Ahora, sí, vamos a proceder al corte. Vamos a hacer el corte. Oh, sorry, yes. Oh, yes, too much, right.
It sounded like everybody understood, but I think
You speak English, right?
clearly we have the spirit of the communication, but essentially, we're here in a day of joy and celebration, and as we finish and we move on to the ribbon cutting, I want you to expand on that joy and celebrate with us and talk to all of us, the staff, with Alicia, with Dilcia, with Catalina, with all the staff who are here. We number 130 now, but also the patients who are here representing the services that we provide, and the public officials who are here to celebrate with us and who have partnered with us, our donors. Be sure and share with all of us, and let's celebrate with music and food, and we move on to the ribbon cutting.
Safety glasses.
All right, everyone, can we have one with everyone's faces up, looking at us, big smiles? All right, we're gonna hold for a couple here, 1, 2, and 3. Anybody want to give a countdown? All right, cut a ribbon on 3. 1, 2, 3.